All right. Well, good afternoon, everyone. Thank you for being here with us today. My name is Kelly Cunningham, and I'm the director of the Suicide Prevention Program at the Massachusetts Department of Public Health. And with me today is Danielle Bolduc. Danielle, want to introduce yourself?
I keep wanting to say good morning, but it's definitely afternoon. So good afternoon, everyone. My name is Danielle Bolduc. I'm the Assistant Director of the Suicide Prevention Program.
And we're both here today to talk to you a little bit about 988 and how that implementation is going here in Massachusetts and how things are going to look come July 16th, which is it's 9 days away from today. That 988 goes live. So the way we're going to work it is I have some slides, which I know all of you have received. I'm going to share those with you right now. I'm going to share my screen in a moment. And then we're going to leave some time for questionings. One of the things we are recommending to people is you might want to wait before you start putting your questions in the chat to see if maybe we answer some of those questions along the way. And then we're happy to be able to spend some time with you. Presentation should only take about 15 minutes, so we'll have a good amount of time to be able to chat together. All right. So just bear with me for a second while I share my screen. All right, and here we go. So again, welcome today. Part of what we wanted to be able to discuss with you is a little bit about what 988 is. We know there's been a lot of curiosity and a lot of confusion as to what exactly this new system, as people are thinking of it as, but we'll describe it a little bit more, what this really is. We also want to talk a little bit about how do the Massachusetts call centers support people who call into the National Suicide Prevention Lifeline today versus what will happen come July 16th. And finally, how some of these programs interact with the 988 call centers. So first, let's describe a little bit about what 988 is. In 2020, Congress designated the new 988 dialing code. So what this is we have the National Suicide Prevention Lifeline. And just so people know, you might hear me shorten that and just call it Lifeline or NSPL, but it's all the same. That currently is a 10-digit number, 1-800-273-8255. That number, come July 16th, is also going to be available in a 3-digit dialing code of 988. So they're exactly the same. So folks that have been calling Lifeline since 2005, which is when Lifeline first started, or who will be calling starting on July 16th, they're going to get exactly the same service as what they've had before, with maybe some little enhancements, which we will discuss in a moment. Here in Massachusetts, we have 5 local Lifeline centers. You have Call to Talk, which is out of Mass 211, Samaritans of Cape Cod and the Islands, Samaritans of Merrimack Valley, Samaritans Inc., and Samaritans South Coast. So these 5 centers, I want you to first remember that these are organizations that have been here in Massachusetts and listening to phone calls and helping and supporting individuals for, in some parts, over 40 years. So this is not anything new that we've done here in Massachusetts. This is something that we have been doing for a long time. And some of these centers have been part of the Lifeline network since 2005 when it first started. So these are folks, again, who have a lot of experience in being able to do this. Now, prior to the last year or so, most of the centers really just worked on using volunteers to answer the calls. One of the things that we have made a change on is having a hybrid model. So now they have volunteers as well as staff members who are answering. They all receive exactly the same training within their center. So if a volunteer wants to volunteer at one of the centers, as well as there's a staff person, they're getting that same exact training, which includes about 30+ hours of instruction to be able to support callers on these lines. The calls are distributed based on the area code of the caller and then routed to the closest center. I'll show you a map in a couple of slides that really gives you a better view of what happens when a person calls into the center versus where they go based on their area code. So we'll talk about that in a moment. It really is important to note that people do not need to be suicidal to call this number. In fact, most of the callers are not. Although every caller is put through a suicide risk assessment, meaning they are all asked, are you feeling suicidal today? And based on that response, there are other follow-up questions that are asked. And again, as I mentioned before, this does go live on July 16th, which is a week from Saturday. So we're coming up close. Some of you may have heard a lot about the new behavioral health roadmap that we are doing here in Massachusetts. This is a complete change in the structure that we have in our behavioral health system. And there are many different parts of it. 988 aligns with this roadmap, and it's just one piece of it. You may have heard of the Behavioral Health Helpline, or known as BHHL. And this is a line that is going to go live in January of 2023. This is something that's being under procurement right now. And I just wanted to talk a little bit about the differences between the two. 988, first of all, I mentioned that they're volunteers and staff that are answering these calls. These are not clinicians. So this is non-clinical support that it is happening when you call 988. However, come January, when the Behavioral Health Helpline is up and running, that will be staffed by clinicians. So there will be clinical assessments and connections to care for those who call that particular number. These two entities will be connected. So if somebody calls 988 and they need support from the Behavioral Health Helpline, a warm handoff will be made to that helpline to be able to assist in those other pieces that a caller may want. In the meantime, we're putting into place some other enhancements to be able to help service callers better. And we'll talk about that in just a sec. All right, so this slide really describes for us a little bit more about what happens when a call comes in and where the calls are going out to. So you note on the left-hand side, we have that little person in green. So they make a phone call and they will dial either the 10-digit number or the 3-digit 988 number. And it goes into a national hub. They, at that point, have an opportunity if they want the Veterans Crisis Line, they press 1 to get that. If they need Spanish speaking, they press 2 for Spanish speaking. Otherwise, they hang on the line and they get routed based on their area code to one of these 5 centers, as we talked about. And the map up in the top right-hand corner just shows you where each center is taking those calls. So we kind of split them up once they come in by area code, then by counties. And the counties really are around the call centers, their location, so that you're getting directly to a call center that is closest to you. Now, the one thing that is really important to remember is it's done by area code. And for a lot of people, you may be living in Massachusetts, but your phone number has an out-of-state area code. That will be sent to the state of where your origin is, where that area code is from. This is a geolocation component that is not currently with these NSPL calls. This is something that's always been the case, and they're working on it through the FCC, but that is not going to be changed starting on July 16th. So we just want folks to understand that piece of it. The other thing that we think is incredibly important is to understand that 98% of the calls that come to these centers currently are handled within these centers. So these centers, their staffing and volunteers are really trained in being able to de-escalate a situation. And it only deems about 2% of them need to have further assistance. These are callers that we deem as imminent risk. And an imminent risk caller is calculated based on that suicide risk assessment. So they need to have the capability, the intent, the desire, and that time frame is something that's going to be happening fairly soon. And this does determine if it's considered an imminent risk call. If that is the case, the call taker will work with their supervisor to be able to call 911 to send help to that individual. The call taker will stay on the phone with the caller until help does arrive. This is the only time 911 is called in a situation with these centers. It's actually part of their requirements to be in the NSPL network. So this is something that they have had to do for quite some time, and that's not going to change with 988. Okay. Now, I mentioned we are wanting to do some enhancements to the system, and this slide kind of talks about that a little bit more. And I just want to focus your attention to the little triangle that we have on the side. The big green part of it, it talks about the emotional support in de-escalation. This is someone to talk to. Above that, you have mobile crisis, which is someone to respond. And then we have 911 up here, and some of this might change along the way. SAMHSA, in putting together 988, really talks about this whole system as someone to talk to, someone to respond, and a place to go. So we want to make sure that we have that in place here too, within our environment of 988 in the state. So as we talked about, right now, when an imminent risk caller comes in, that's the only time a call gets out of the center. We're adding in a component that if a caller is what we consider maybe at moderate risk, so maybe this person has been feeling suicidal, they have been thinking about suicide, they might have a plan, but they're not acting on it, but they definitely could use some additional support. The call centers will now be able to make a warm handoff to an emergency service provider in the area of the caller. So this is a new enhanced feature of the 988 system that will start on July 16th here in Massachusetts. We know people have questions and there's more information, and we want to leave time here for you to ask those questions. But you can also go out to our website, mass.gov/988, for more detailed information. There's a section on FAQs. There's also, which I think is really important, these centers are constantly looking for new staff. So if you know of anybody who would be interested in working for one of these centers, or even as a volunteer, there is a section on how can I find employment at these centers. So you can go in and check out their website. The other thing too is just to let folks know, we do have marketing plans in place. So come July 16th, you're going to notice very slight changes. The logo that you see in the upper right-hand corner of this slide is a logo that has been approved by SAMHSA, and one that we are going to be using on all of our websites and any marketing. And that's what we ask anyone else who currently has NSPL logo to change it to this 988 logo. So that is going to be one of our changes. There'll be other signs that you'll see along the way changing, but what we're not doing is a huge marketing push. We really want to see how many calls are being driven to this line before we start doing a bigger marketing push. We're following SAMHSA's lead on this, and we ask that people just have a little bit of understanding on, it's not that we're hiding the number, it'll be out there. We're just not doing huge marketing push until we feel comfortable that things are going in the direction that they should be, and SAMHSA is in agreement with that. So that will all be happening along the way. But you can definitely look at our website to get more information on those types of things. So I know that was a lot of information, and I want to take a moment now for everyone to think about if there are any questions that you might have, anything that I might have missed along the way. And I'm going to bring down my slides, and Danielle and I will check the chat and see what we can do to help answer these questions.
Yeah, so while we're waiting for additional questions to come in, we did have a few come in while you were talking and presenting. So thank you so much for that information. There are a few questions about the area code routing and just clarification there in terms of access to local resources. So Vibrant, who's the administrator of the Lifeline at the national level, does ask and request that centers have a resource directory or access to resource information to be able to provide callers, should that be something that callers are in need of at that time. There are about 200 crisis centers that are connected to the national network. So our local call centers are really only going to have information that's pertinent to their state. On the Lifeline's website, they do have a call center locator. Pardon me, because there was a follow-up question about if someone gets connected with a center, but that's not where they're located, can the call be redirected? Unfortunately, the call cannot be redirected at that point in time, but there is a call center locator on Lifeline's website. So, you know, the individual or you or together, they could go visit that website and find local and direct information for the call center in their area. There was also a question about TTY. So I don't think we really talked about the other ways you can access this. We've been pretty focused on the phone-based support. There are TTY services. There is a number identified again on the Lifeline's website, which we can pop into the chat. And so you can use the identified number or preferred relay number. There is also chat and text services. Chat is currently live and people are available to respond to chat. That is a conversation you can initiate on Lifeline's website. There's a link and I think there's a brief survey just asking a few questions before the conversation begins. And text will also be going universally live alongside the 988 number come July 16th. And then before I turn back to chat, there are some questions from before about some more clarification around the imminent risk protocol. So the imminent risk protocol is defined by Vibrant. So those are national standards that all call centers that are part of the network abide by. And they also provide risk assessment standards that Kelly had referenced before. So what's really being assessed on the phone conversation is the presence of desire, capability, and intent. In the imminent risk piece, that's really the time frame, right? So sometimes someone on the phone call has already taken some action to end their own life, or the time frame is imminent upon perhaps the conclusion of the phone call. Involving 911 is really the last action of resort. Call centers' primary aim is to de-escalate the situation and to keep the person safe wherever they are. So they'll go through a number of things with the caller to try to de-escalate, potentially safety plan to come up with a way that they can potentially remain safe. If those things are gone through and they're still not feeling safe, an offer of emergency medical services will be made. And sometimes the person is, they agree to that. They agree that they're in need of those services. If all of those things have been all those options have gone through, the person's still not feeling safe. There are some situations where the call centers might have to break confidentiality and reach out to 911 to try to locate the person. So Kelly, I don't know if while I was talking, you were scanning and if anything new came in.
Yeah, I did put in the Lifeline website so folks can take a look at that. And I also included SAMHSA's website. They have a page designated just for 988. And on there, they have a partner toolkit, which includes the logo and approved branding. So if you are changing the logo on your website, you can use the logo that's listed on this particular web page. Also, too, if you search the SAMHSA store, they have a whole section of 988 materials that can be used that are approved. This includes posters that can be put up, as well as wallet cards. So anything that we had used previously with NSPL, they have created new ones for 988, and they can be found on the SAMHSA store. So please feel free to download those or take a look at that. I know that there was a question about, different roles that people play around with lived experiences, CSP, CSWs, recovery coaches. One thing that we, need to remember is, again, like I said, the folks that are answering the 988 calls are volunteers and staff. They are not clinicians, but it can be anybody. Anybody can go for a job at these centers to be able to answer the call. So that's not a hindrance at all, but they don't have like specific peer folks that are answering the phones. The other thing too, as far as least restrictive referrals, when the call taker does that warm handoff to the emergency service provider, it's then in their hands, and the emergency service provider may decide we're going to link them up with a clinician, or we're going to send mobile crisis. But the goal is to do the least restrictive means at that point. That is what they are trying to do. And with the changes in the behavioral health landscape here in the state, we're going to see more changes along the way, especially when the community behavioral health centers come up and play. There's going to be a lot of other options, but we have to wait for the system to catch up. 988 just happens to be going first in the line of the way things work here in the state.
And I just wanted to clarify too, right, that the workforce that is working under these 5 centers, there's a variety of lived experience that's represented there. There's probably over 450 folks that are working, answering calls, supporting people that are answering calls. However, it's not an official peer support model. It's focused on emotional support and de-escalation. There are warm lines that do utilize that peer support model, right? And that is an available option to folks. It's just the warm line is a different model, and it's not, those centers aren't connected in answering the calls that come in through the national network, the Lifeline national network. We had an age question. So yes, folks under the age of 18 can call. Kelly had referenced, right, this isn't a clinical workforce or a clinical model or clinical intervention. And alongside that is there's no formal intake process. This is a free, anonymous, confidential 24/7, 365 service. So again, no, we do the risk assessments questions, right? There's a name, greeting, and exchange at the beginning of the call to open it. But callers decide what they want to share. They can share the real name, they can make up a name, they don't have to share a name. So it's really self-directed in that they're in the driver's seat for that. And I'll just make a note too, with the chat and text, there's usually an age of an ascending age of 13 to use online services.
And speaking of text, somebody just asked the question if the crisis text line is also part of 988. I can't speak to that because I don't know if the crisis text line has become part of the network. And that's what they have to do, right? In order for any crisis center, call center, texting service, whatever, to be part of the 988 network, they need to be part of the NSPL network, which means that they're following the guidelines that are provided by NSPL, and they have to get accreditation. That's also incredibly important too.
Yeah, as of today, Crisis Text Line is not part of the network and is a private, separate organization.
Yeah.
I see a question about volume, and I think you alluded to this at the beginning, that also, right, that this is an existing service, the national network, the Lifeline has existed since 2005, but also that these call centers have existed in the state for over 40 years. I misspoke yesterday. I said since the 1960s, but it's since the 1970s in Massachusetts. They have their own local helplines as well that they've been answering and doing this work for a very long time. So I would say between the NSPL calls received as well as the local volume received, it is definitely over 100,000 phone contacts answered in a year.
Yep.
Substantial.
Let me see. Our call is being informed consent about potential breach of confidentiality related to the 911 handoff. They are told, like, if it gets to that point where 911 needs to be brought in, the caller is told, you know, we need to gather more information. But you have to remember, the call centers do not have electronic health records, so they're not taking down this information and storing it anywhere. Once they make that handoff is made. So they are known, you know, they do let the caller know that this is what's happening. There are cases where a person might not want that to happen, but if this individual is an imminent risk and they have started an action, we are required to be able to send somebody out.
Yeah,
so that does happen.
There's often information and disclosures made on the websites, as well as if someone asks on a phone call, right? It'll be asked and answered, honestly.
Mm-hmm. We will say this though, if a person is at moderate risk and the call taker wants to be able to offer the services of a warm handoff to an emergency service provider, the caller will have that opportunity. If they say, you know what, I don't want that right now, and that's fine. They will not be forced to make that transfer. The only one that we have to do is if they're in imminent risk. Let's see.
I see a question about response time around ESPs. So I want to try to answer it, but also acknowledge that the crisis services here in Massachusetts landscape fall along a continuum, and we're only here today representing really the 988 in the call center piece, right? Kelly mentioned the roadmap. ESP is another important partner, and I recognize and I'm aware that wait time and capacity is an issue. It is a challenge across the mental health field and the workforce at the moment. So if we make a warm handoff to an ESP, the person will enter their normal standard workflow. And also I know that ESP is currently under reprocurement and that they are also hard at work to build their capacity to be able to respond in a more timely fashion.
And there was also a question kind of related to that about if a caller needs resources and the behavioral health helpline is not up yet, where they're going. They're going to the ESP. The ESPs are the ones that will provide that resource until the helpline is up and running.
Yep, if they need community-based, clinical intervention, that will be the resource. If they need more resources that are focused around food or housing, 211, I think, is our statewide experts around that. And then there will also just be other general local resources for the state that each call center will have access to in their database.
And there's a question about, can a parent call on behalf of their child? Absolutely. But a lot of times on these calls, the call taker wants to talk to the individual themselves. So they may, if the child wants to get on the phone and have a conversation with a call taker, it might be better, but a parent can certainly call if they want that. Third-party callers call quite often. So they are provided, some of those resources if needed to be able to help support that individual.
Kelly, did you already address the question about marketing, right? We're doing a soft launch for next week, but are there any existing information? I think you shared the Lifeline website. Oh, yeah, you shared SAMHSA too, sorry.
Yep, I shared SAMHSA. Yep.
I feel like I started at the top. You started in the middle.
I know. It's like, where's it happening? So there's this question about what happens when a caller discloses information that we deem as imminent risk. but the area code doesn't reflect their current residence. They're actually asked, can you provide us with the address of where you're located? That's going to be incredibly important. As much information that the call taker can get from the caller to be able to pass on to 911 will be needed. So yeah, we know that sometimes the area code will not reflect, and they'll be asked that. Same goes true too for that warm handoff to an ESP. They'll be asked, what's the zip code of the location that you're at? If they don't know the zip code, can you tell us what city you're located in? You know, and the call taker can look up the zip code, put it into the system so that they get to the right center. That's going to be really important too.
Yes, in the call centers, that imminent risk policy has been in place since 2012. So that situation has definitely come up, and it's something that the call centers have had to navigate in the past and worked with 911 systems that are outside of Massachusetts.
Yeah, and I think something else that's really important when we're talking about the imminent risk policy, the call taker doesn't make that decision on their own to say, this person needs to be transferred to 911. They are working with a supervisor of sorts within each center to make that distinction or that determination of is this person at imminent risk. So, you know, it's really important that the volunteers and the call takers are getting the support that they need in making some of these decisions too. So there's always support available for them, so they're not doing this on their own. So I have a question here on who is on the ESP teams and what trainings and qualifications do those folks have. They're clinicians that are on the teams. So they are have gone through, obviously, you know, master level trainings. They have their own trainings within the centers on how to be able to support. They also, as part of this process that we've been going through, we've been giving them some videos to help them with the training. We've been having them meet with the call centers that are within their regions to really get to know each other better, so they know, like if somebody calls and say, hey, I'm calling from Samaritans in South Coast, the person at ESP can say, oh, okay, I know that this is a 90-day call. You know, we know what we're supposed to do in this situation.
There's a question about what call center covers Western Mass, and there is a map in the slides that you all received. Kelly had mentioned that we try to assign the primary geographic location as the primary coverage for each center. Our coverage extends as far as Springfield, so we hopscotch over a little bit, and currently it's one of the Boston Center that covers Western Mass. And someone just put in a clarification note too, which I appreciate. So I just wanted to call attention to that the area code routing is based on the entire national network. So it's not a challenge that is unique to Massachusetts. But again, right, that comment on the majority of the calls are handled within the call center, and that emotional support that is being provided is the primary service that's provided, and also the primary service that people are seeking at the time that they call. So that emotional support conversation can happen anywhere.
And something else, go ahead, you want to
Sorry, I think there's another comment and it just reminded me, but it would change topic. So if you had something to add on to that, I will pause. Okay. You had talked about the ESP workforce and that they are mental health clinicians, often master level, but I also wanted to mention that peers are a part of that workforce. So oftentimes a clinician and a peer are responding.
What I was going to bring up is something else we didn't discuss, which is what if somebody of a different language calls the line? So I did mention that Spanish speaking have an option of pressing 2 when they dial 988. For any other language, all of the centers have language translation capabilities. So they do use that service. So if somebody calls in and they have a different language, they can just ask for that and they'll call into the translation service to be able to support the individual.
So lots more questions about 911 intervention. And we're not trying to not answer the questions, but it also really depends highly on the context of the situation. In each situation, you can take thousands of calls and really they're unique each and every single time, the context. So in terms of if a phone call disconnected, it would really depend on what a supervisor might do, depending on how long they had been talking, how much information had been gathered. So that's hard to just say black and white. And then just in terms of working with other 911 systems, it really depends. The call centers do not have, since the calls are not routed through geolocation, the call centers do not have any physical address location available to them, right? It would have to be disclosed by the caller. The only piece of information that a supervisor has is a phone number. So if they're working with someone and they agree to medical services, emergency medical services, they would provide their location, and then the supervisor would work to contact the appropriate 911 PSAP. The call taker would remain on the phone with the person to continue to provide them support while that emergency medical service connection is being made. And there are circumstances where someone cannot be located, right? Because we don't have that information. So sometimes 911 will agree to ping a phone, but that is hard and there are challenges there. So it's not always a guarantee that someone can be found.
And to add to that, there was a question about what if a person hangs up mid-call? Is there a follow-up call made? If this is, they've been having a discussion and the person is not at high risk, no, they're not going to be doing a follow-up call. I don't know, Danielle, if because I'm sure this is going to be a question, if that person is in imminent risk and this is in the middle of a call, do you know of a situation where there might be something done in that case?
It really depends on the context. So it's super hard to, kind of
Yeah.
make a blanket statement. I'll say that in, my former role as being a supervisor and on call, have I had one or two calls where, they have maybe been on a lengthy phone conversation and it felt very disconnected in a very, high risk moment. Might we call them back to try to continue to engage before we made any other decision? Sure. But that will always come down to the very specific context of that conversation. It really, really always the values of just trying upholding the self-determination of the caller are centralized.
Mm-hmm. And just as to kind of repeat, 988 it's a phone number to get to these centers that have been doing this work for a long, long time. So it doesn't replace the other systems that have been like a section for somebody. This isn't replacing any of that. This really is about having a phone number that is a 3-digit number that's easier to remember, right? So that people are not sitting there going, what's that 10-digit number that I need to call when I'm in crisis? That's really what this is about.
There's another question too about kind of ESP, and I just wanted to speak to that as an additional avenue to provide people with community-based support as well as a diversion from 911. Our connection and our partnership with ESP is actually an exciting new part of 988. These have been traditionally very siloed pieces of the system. So we've been working very closely with the statewide ESP program, with Beacon Health, with all of the funded providers in that network. So our hope and aim is that if we've gone through our risk assessment and they're not at that level of imminent risk, and we do not believe that they require 911, we are hopefully handing them off to ESP for those services that they provide, and that it would not be a handoff that would indirectly reroute to 911. That is not the intention. Also, a warm handoff to ESP will only happen with the caller's consent. So it's only something that can be done with their agreement and collaboration. So that has been part of the conversation. And then I think the asterisk, right, is that crisis situations can change rapidly sometimes. So if a handoff, it will enter the ESP workflow. And if they have to do risk assessment again as part of their workflow, and the crisis situation changes and that risk level changes, and then they will follow their protocol and policies.
There was I saw a couple of demographic questions. I just want to address that. Really, the call taker does not ask for demographics when a person calls in. So they're not asked their age, their gender, their race, ethnicity. None of that is gathered as part of the phone call. So, you know, I know there was a question in there about asking about the gender and the risk assessment, that that doesn't happen. What happens when they go to ESP might be totally different, but 988 itself doesn't ask for that. And it's really because these are confidential calls in that moment, right? And so it's not, we don't want to make a person uncomfortable by having to share their age, their gender, their anything else. We want to be there to be emotional support for that person in that moment. So just want to make sure that people do understand that.
And there's a question too about texting. So just a reminder that both texting as well as the 988 number are not live officially and universally until July 16th. It's not universally operational until that date. I know some people have access, but not everyone. You can text the 10-digit number. They are able to respond to that. It has not been a formal texting program on the 10-digit number. It was one of those things where folks just started texting and they started receiving messages. So they are responding to that. But the formal text program will launch with 988 on July 16th. And there is another question just about the suicide focus of this network. So it has the history of being suicide focused, suicide prevention focused, because that's, that can be really important, and there's not a lot of other space where that happens. However, we know that there's a lot of co-occurring things that happen in our lives. So there is no qualifier to call this line. Like Kelly mentioned at the top, you don't have to be suicidal to call. And of course that people are talking about and sharing so many different life experiences that they're going through. So the risk assessment is specific to suicide and safety in the moment of that call, but anyone can call and talk about anything.
And I saw some questions in here asking more about the language translation line and the different languages. And I think one thing important to note, when I said that for Spanish speaking, press 2, that actually brings them out to a national center. It doesn't bring them to a Massachusetts center. So this is just something, there are, 3 or 4 centers nationally that handle all the Spanish speaking calls. So that's why, the language translation within each center is incredibly important. It's hard for them to be able to hire people of multiple languages within these centers and to have them 24/7. So the language translation line helps support that. From what we've been told, it can take up to, less than a minute to a couple of minutes for them to get the right translator on the phone, but it's not a huge amount of time for them to do it. So then, when they do that locally, they're able to handle many of the other languages that we have here in the state.
Yeah, and the Spanish line is a sub network. So it is a call center that is a part of the larger network, but they have both the language and cultural competency to be able to translate specifically for those cultures. So that's why they're specific designated call centers that are part of that sub network.
Mm-hmm. And the question about, will the old number be rerouted to 988? They're identical. They're the same. They go to the same hub. So there won't be, callers won't even know the difference. Whether they call the 10-digit number or 988, it's going through the same hub.
There's a question about geolocation. I'm not sure if we already answered So I will
Go ahead.
pull it up again because I can't remember. And so geolocation does not currently exist. It is currently a conversation of whether that should become a new routing method. And that's happening at the national level. So FCC is at the table, SAMHSA is at the table, Vibrant's at the table. So they're talking about it, but it doesn't exist right now.
Yeah. And it, again, so the language translation service thing, again, remember, it's a translation service. So the call taker is still going to be on the phone to be able to help with a lot of the specific issues that are going on. Are they fluent or have relevant specialized vocabularies? I can't answer that question. I don't know about the service, but we do know that this is a service that many of the call centers around the country are using. And if a person who is not in Massachusetts and they're asking for ESP services, they will not be able to be transferred to ESP. That's going to be important. They'll have to, there are some features within NSPL to be able, that's an area that's still under, I'm sorry, I know I'm messing this up. It's been a long day. It's really difficult for them to transfer somebody out of state if they're looking for ESP services in another state. So that cannot happen.
Yeah, so I mean, the tricky part of this is that it's a national network, so we do have national standards and some consistency. However, the national network is constructed of state landscapes, and all of our state landscapes in this space, in this mental health field, are different. So we've been talking about, our infrastructure here in Massachusetts. So it would be incredibly hard for our entire workforce to understand in great nuance and detail the entire structures of all of the other states. So if we do have someone that's out of state that's looking for resources, we probably make a general referral back to the 211 program, as that is nationally available and would be potentially, hopefully, a good starting place. Again, as well as that crisis center locator map on the National Suicide Prevention Lifeline's website.
Let's see. I don't know if we've been able to get all the calls. I mean, all the questions.
Yeah, it's just scrolling.
Thank you for all the questions. They've been excellent. We hope we've been able to answer them sufficiently for you.
Oh, there's a comment here that I just wanted to pull up. It was part of the conversation for the ESP workforce, and someone mentioned that ESP also has family partners as part of CBHI, which is the Children's Behavioral Health Initiative. So thank you for that comment.
Mm-hmm. Can lived experience professionals be part of ESP teams and the behavioral health helpline? The answer to that is yes. I know Danielle already mentioned there is some peer support within the ESP teams that's happening. And I know with the behavioral health helpline in the procurement, they requested, like, there's a lot of different folks that have to be part of it. And those with lived experiences and peer support is part of that particular procurement. The other thing that's part of the procurement is whoever it becomes the behavioral health helpline, that they will eventually become a 988 center as well. So they will become part of this Lifeline network, which means they're going to have to go through the same process our 5 centers have already done and become accredited to be able to do that. But that could take up to about 2 years before that happens. If we missed any questions, please feel free to put them back down at the end. There's been so many of them. I'm sure we missed one here or there.
Yeah, it's just scrolling back through, but
yeah,
I feel like we addressed everything. Maybe not specifically, but globally in a combined fashion.
And again, we will be updating our website. So we can be put more information out there. We encourage you to look there. We encourage you to look at and grab the logo on the SAMHSA website so that you can update your own materials, as well as the SAMHSA store for the posters and the wallet cards and that such. You are welcome to be able to grab that information.
Did you put the link to our website? I think you did, Lifeline and SAMHSA.
I think I did, which I don't even have it open right now. You put that in, okay. Is there a place for standards and protocols on Vibrant's website?
I'm not sure what they make publicly available. So there's potentially, I believe I found even the imminent risk standards just doing a Google search. So I believe those should be available. A lot of their standards, policies, and procedures are informed by committees that they have, with a lot of different representation on those committees and panels. And then also the accreditation piece is yet another private organization. So they're all currently accredited by the International Council of Helplines. And I believe that you can find their standards on their website as well.
Mm-hmm.
And it also lists out and reviews all of the things that should, the minimum training requirements that are addressed.
A question popped up at the end, which I thought I had answered, but maybe not. If this does not replace our current system for Section 12 or crisis referral, and that's correct. This does not replace that. Again, the call centers do not do Section 12, so the 988 that's not the intent of this at all. So they are not doing that process. In fact, they do everything they can to help de-escalate the caller so that doesn't have to happen. It might only happen if it's an imminent risk, and that gets called out to 911. So this is not replacing that current system. All right. Well, if there aren't any other calls, oh, here's one. Will 988 ever send folks in distress to 911 to 988? This is a work in progress, because as of right now, the way the system is, there's too much for us to do all at one time with trying to hire folks, trying to make sure the ESP warm handoff happens. We have to take this in stages. So at some point, we're actually talking about this when the behavioral health helpline comes up, so that to make some of these transitions happen. 911 is huge. It's a huge system, and to train all of their folks multiple times to do some of the same things just in different ways, it just wasn't realistic. So we are working on that eventually that will happen, but stay tuned.
And 911, I don't know if you talked about our implementation team, but 911 statewide program has been at our table. So they've been working alongside of us. And so that will be one of our next phases coming up, is looking to see if they can do handoffs to a lower risk system.
Yeah, and I think probably one of the best parts of this whole process is how many of these programs that we've never worked together, everybody's always worked in their own silos, they're all collaborating now to be able to best support an individual. And I think that's going to make a tremendous difference for the residents of Massachusetts come down the road. So with that, I think we can sign off and say thank you to everyone. Thank you so much for all your questions, for your patience with us as we were reading through the questions to answer them for you. And we hope that you were able to obtain some more information and understanding about 988 and what we're doing here for Massachusetts folks. And we look forward to keeping you up to date as things change, and they will. And we want to be as transparent as we can to let you know what's going on. So thank you so much for being with us.
Thank you. And thank you to our interpreters.
Yes.
Kelly, there's a question about where folks can access the recording. Do we know that yet?
I think Laura is sending it out with the evaluation.
Is Laura still here? Can you help us out, Laura?
Yeah, I will actually, I'm gonna put it up on YouTube first, so I'll send out a YouTube link.
Okay, thank you. And that will be distributed with the email.
No, I'll send it out in a few weeks.
Okay,
So it'll be sent out in a couple weeks. Yep,
thank you.
you're welcome.
As far as somebody just asked, where can I find the procurement? Go out to the mass.gov website and do a search for the behavioral health roadmap. You'll get more information from that website. And Combis would be the other place that you would find any procurement.
It's not very user friendly.
It's not user friendly.
Go to maps.gov.
Have a great day, everyone. Thank you.
Thank you.